I'm Sam Durland, and I'm here to talk to you about insulin resistance and why I think it's super important. I also acknowledge that sometimes some of the things that I say might sound different than other physicians, but I like to try everything that I talk to patients about, and I try to really watch what I eat and how I eat, and I can tell you that it makes a huge difference in my energy level and how my brain works. Now, when you look at history about eating can prevent or help treat 80% of chronic disease. That's the most powerful thing you can do. And it has absolutely nothing to do with anything I prescribe, and it has everything to do with how you think about life and how you eat yourself. So it's very empowering to understand. Now, what the heck is insulin? Insulin is a hormone that's secreted by your pancreas, and your pancreas sits right in the middle of your body. And what insulin does is it helps drive glucose into the cell. So if insulin is too high, that makes you feel bad, and if insulin is too low, you feel really bad too. I'm going to use the example of diabetic moms who are pregnant to help people understand why insulin makes people heavy, or it just helps, it makes us hold on to body fat. So I have done a lot of OB, and what do we get concerned about with pregnant moms who have diabetes? You get worried about big babies. And why do you worry about big babies? Because mom's insulin in gestational diabetes is high, and also their glucose is high. So that glucose crosses the placenta, but the baby's perfect. So the baby pumps out all this insulin. And in pumping out that insulin, they come out really big. Now, they don't come out with bigger heads or longer legs, they come out with bigger tummies. And that's the exact same thing that it does to us as we continue to age. It makes us hold on to body fat around our abdomen. So how do we control insulin levels? We control insulin levels by how we eat, how we exercise, and our eating intervals, if you will. So you want to eat frequent small meals, because when people go for a long time and they fast, what happens is your body makes energy with glucose. So a lot of times, again, with pregnant moms, I bring down their morning glucose values by having them have a snack at night. Because if they don't eat that snack over the evening hours when they fast, their body goes to the liver makes sugar, that sugar spikes their insulin, and in the morning their glucose is elevated. So if they eat a snack at night that's higher in protein and fat, then their body can kind of sustain off of that all night, so when they wake up in the morning their glucose is actually lower. So I actually can lower people's blood sugars by just having them eat more of a different type. So in the daytime too, a lot of folks think, I'll just eat once a day. But the problem if you just eat once a day is your body's fasting for the rest of that day, and your insulin levels will increase. And the way your body deals with that is by mobilizing sugar, and that makes you feel really tired. Because during the day when your body mobilizes the glucose, when you're insulin resistant, your insulin values are going to increase, and your body's trying to push everything in the cell. And until it can get that glucose in the cell, it keeps spitting out the insulin, and then finally you overcome the cell threshold and everything rushes in and your glucose goes down. And that's when people get sweaty and quote unquote get hypoglycemic. They feel like they might pass out, they get kind of lightheaded. The reason you get lightheaded is because your brain uses glucose for energy, but if all of a sudden all the glucose goes away because your body's having this massive shift, your brain can't think. The treatment for that isn't more sugar. The treatment for that is to eat more frequent, small, balanced meals, and then your body doesn't do that anymore. And when you think about how folks eat, a lot of folks also would like to eat a lot of fruit. Well, fruit is grown from the earth, but there's a lot of sugar in certain fruits. So you want to try to concentrate more on eating more vegetables. Fat is great, but you want to be moderate about your fat intake. You want to have those protein stores throughout the day and eat every 3 to 4 hours basically, and that really helps your body feel the best it can feel. This can get so much more technical, and there's so much more that goes into that, but in a nutshell, insulin resistance is important, and controlling it will make you feel better.